right away want to send out a message to those who are perhaps preparing for the vacation of their children. First, I want to repeat that we have to be careful with people 65 years and over. I'm repeating the two numbers. I'm annoying with that, but I'm going to continue doing it. 80% of hospitalizations are people who are 65 and over. 95% of deaths are people 65 years and over. So it's not because we don't love them. We love them. And we'll have the opportunity after the pandemic to visit them even more. But let's be quite clear. We cannot imagine a person 65 years of age during the school break in a cottage with people with whom the person does not live. Also, a person who is 65 years of age cannot babysit the children because the children are in spring break, and I'm talking about the grandchildren in many cases. So we're going to have measures, of course, but we do have concerns. We all remember what happened last year during the spring break. So we have concerns. As long as people who are 65 and over are not vaccinated, and speaking of vaccines, we just had some bad news. What is being announced to us is that we're going to receive even fewer vaccines than what we thought we would. So that means that I think that a date that is going to become very important is when will we have vaccinated all those people 65 and over. I think that that will completely change the situation in Quebec. But unfortunately, with the news that we're getting, that date is getting further and further away. And it adds to the reasons why we must continue with our lockdown measures. So to keep the vast measure of them. The vast majority of them, I'm sorry. And of course, the variant, particularly the British variant, is a worry for public health. I don't know if there are many people who are looking at what is going on in the United Kingdom right now, but I was looking at yesterday's numbers, 37,000 hospitalizations because of COVID. 37,000 hospitalizations in the UK, a modern country where they have rules. If we make it a rule of 3, it's as if we had 4,600 hospitalizations in Quebec instead of the 1,264. So we can see that if the variant were to become rooted in Quebec, like in the United Kingdom, it would be a catastrophe in our hospitals. So that is one more reason to do something about traveling internationally. And I want to be quite clear. First of all, on one thing, I checked and rechecked with the jurists of the government. There is no means for the Quebec government to be able to create a bill without a very significant risk that it be contested, to be able to manage this aspect instead of the federal government, the entire quarantine of travelers coming back to Quebec. So that is quite clear. And so we need, and that is why, and it's not because I'm trying to be unpleasant, but I'm going to make that request once again to the federal government, to Mr. Trudeau. I think that it is urgent that we take one of the two possible solutions, that is either forbidding non-essential travel outside of Canada or making a quarantine mandatory in supervised hotels for all travelers who will be coming back here in Quebec from traveling abroad. So perhaps, just to end with, or almost, some good news. We have signed, this is news concerning autonomy. So good news for the autonomy of Quebec concerning medical equipment. We all recall that last spring we really had been scared that we would not have enough masks. Well, we have signed an agreement with a Quebec company called Medicom that is going to deliver 20 million N95 masks and 66 million procedural masks. So we'll get millions of these every month. So this reaches two objectives. The first is to have more autonomy, and the second is to create good-paying jobs. jobs in the manufacturing sector. And it's one that I wanted to give as an example. The mask is made by Medicom that we've started to receive. So this is one. Yes, and the N95 is the one that is made with a kind of like a beak, like a bird, like a duck. And it's very efficient and approved and everything you want. And perhaps just to end with, I've said it twice already, maybe I'll say it a third time. This morning we had a caucus, a pre-sessional caucus, so that is in order to prepare the following session, which should start next week. Maybe just to explain to you that we had proposed, since the measures are going to be revised on the 8th of February, we had proposed that it start again on the 8th of February, but the opposition wanted to go earlier. We wanted to act as a model, but the opposition wanted it to be next week. I really look forward to answering their questions, and I had my telephone conversation that lasted an hour yesterday, as I have every week with all three leaders of the opposition. Perhaps I won't have a whole hour to answer during the question period next week, so there's no problem on that aspect. But I do want to come back on the discussions that we had at the caucus this morning, because of course in the past year the pandemic has taken up a lot of room. But I want to reassure Quebecers, we are all quite determined and very convinced that all the electoral promises that we made during the 2018 campaign, that we'll still be able to keep them. So that means, among others, the promises we made in education, the development of kindergarten at 4 years, the addition of services for children who have trouble learning problems, the renewal of schools, the construction of beautiful schools. In the economic sector, we still have the intention, and we have a lot of beautiful projects that I look forward to being able to announce, to be able to create good-paying jobs in the manufacturing sectors, among others. And we're going to be continuing with our promotion of purchasing products made in Quebec, so that certain products that we used to import, and the example of masks is a good one, and it can be applied in many other products. So to be able to say that we are going to be developing the manufacturing sector in Quebec, and that we're going to try to convince Quebecers to buy more Quebec-made products. So that's a great opportunity on that end. And there's another sector that's very important as well, and it's the digital sector. And I'd like to send out a message now. You're going to be seeing ads more and more. And we are missing tens of thousands of qualified people in information technology. So all young people, and perhaps not so young people, who want to perhaps recycle themselves and go into information technologies. So everything that has to do with IT, you know, the pandemic is accelerating everything and is presenting good opportunities for a new economy in Quebec. The other thing that is important as well, and I want to launch another message. You remember there were 340,000 homes to hook up. There's still 280,000 homes to be able to wire, to be able to have high-speed internet. So it's a message to Bell. We're talking a lot to Bell, as much so that they do some of this work themselves, but so that they also quickly lend us their equipment, so that the Videotrons and other companies that also do high-speed internet can do that, so that we have access to the posts. So I'm very determined that the 280,000 homes that are still left are going to get wired by the end of our mandate. The other one is identity and culture. We're going to be filing, Simon Jolin Barrette is going to file a bill to review Act 101, so the Charter on French language. There are debates coming up. I already see some with Dawson and CJEPS, but we are going to have a law to reinforce the presence of French in Quebec. Of course, we're going to wait a little for the pandemic to calm down to be able to have a good debate. We're also going to continue investing in trains, tramways, electric trucks, electric buses, perhaps a word on the Quebec tramway. I know that Mr. Labaume is impatient. We want to do it, and we will do a tramway in Quebec, but do recall, Mr. Labaume arrived with a new version. We find that it does not serve the outskirts of Quebec enough, and it was a condition since the very first day in 2018 to better serve the outskirts. And of course, they're all projects as well, the REM in the eastern Montreal, projects in Laval, and projects on the south shore of Montreal as well. And we also have our homes for the elderly. It's almost a coincidence with the pandemic that honestly, nobody had predicted, but we will be able, by the end of the mandate, to announce many new homes for the elderly that are going to be replacing the CHSLDs, where there's going to be a lot more light, a lot more room for our elderly who deserve this. So we will be able to fill and meet all of our promises despite the pandemic. Last news, I want to announce to you that on the 11th of March, we will have a commemorative day, a national commemorative day for all who have disappeared because of COVID-19. So we want to have a special ceremony. There will be a part here in Quebec, but also a part in all regions. So we want for the entire Quebec nation to be able to offer their condolences to all the families and loved ones of those who left much too quickly. So soon we'll be giving you all the details of who and how it's going to take place. But I just want to say, to end with, that we are talking each day of numbers, but beyond the numbers are people and families. And a good way of paying tribute to them is to continue following the guidelines so that there are fewer in the weeks and months to come.
Good afternoon, everyone. The situation continues to improve compared to the last weeks, but the number of hospitalizations remains too high. We need to reduce the number of people in our hospitals so that we can restart surgeries that have been delayed due to COVID. We have to think about those who are waiting for surgery. Next week, we'll announce a lifting of certain measures after February the 8th, but we have to be realistic. Most of the measures will continue. We're also concerned about the school break. We don't want people, especially people over 65, meeting friends or family members who don't live with them or babysitting children. Regarding international travels, I want to be clear, Quebec cannot act alone to impose quarantine on travelers. So I repeat my request to Mr. Trudeau. It's urgent that we either ban non-essential international travel or impose quarantine in hotels for travelers. I'll finish by announcing that on March the 11th, we'll have a day to commemorate those we have lost due to COVID. We want to offer our sympathies to their families. We must never forget that behind the numbers, there are people and families. There's a good reason to continue all our efforts. Thank you.
Merci. Le Premier ministre, le ministre.
Thank you. We will now go to the question period, first in French and then in English. I wanted to talk to you about the quick screening test. Do you agree with Dr. Don Shepard from McGill University, who said that the delay in the more massive usage of these tests probably cost Quebecers lives? Well, I can answer. I think that some people can have that opinion, but I think that we have followed all the recommendations of public health and have done so since the beginning. I would like to give you examples, and I say it often, we have absolutely nothing against the rapid testing. In our situation in Quebec, we've never not had enough tests, and we have to make sure to define in what circumstances we can use them. And the main problem that we've had and the pressure that we've had from everybody was to use tests at random in mass usage, whereas we did not have the conditions to do that. So I just wish to make a reminder. After having talked with public health After having made the validation that we've made throughout the past few months, we have arrived at an adjusted opinion of public health that now we could use the rapid test as long as we had the correct conditions to do so. And without going into detail today, but it is something that I've said very often in the past few months, in situations where there are important outbreaks, it is a lot easier with rapid tests to do a first triage and then to see those people who are symptomatic. Because the problem, and public health has told us, and the NSPQ has looked at it, the rapid tests can give false negatives up to in 1/3 of cases. That is to say that 1 case in 3 of people who are not symptomatic cannot be detected. So if we have the choice in making a PCR, so our conventional tests, we do not need to go get a rapid test that we would have to revalidate or requalify after. So what we've asked, and we have a guideline that was emitted in the past few days, together with public health, we have told all our CEOs of all establishments, now here are the conditions under which you could use a rapid test that would be complementary. But we also needed to have the reagents of companies like Roche who present the equipment to us, etc. So what I would say today is that we did it out of prudence. It's not that we weren't prudent. We wanted to be prudent, and we wanted to make sure that we would use them in the correct circumstances. So I'll give you an example now that things are clarified. We have the equipment to do that because rapid tests, people think that it's fast because there's not going to be anything in the nose. It's the opposite. You still do need a swab in the nose, and you need a nurse who is qualified to do that. The only difference is that you get a result in 15 minutes, but the test is still done. It's still a swab in the nose. So we have to see under what circumstances we can conduct rapid tests in a way that is complementary to what we already are doing very well. So we can give you more details, but when, what I've read or what I heard this morning, I find that maybe we would need to explain once again in what circumstances and if it's necessary. And I'll tell you, it's been such a long time that many things are being said about this, that if we have to do a technical briefing some morning with the people from the NSPQ to come to explain under what conditions these tests can be used and what is the guideline that was given to be able to use the rapid tests, I'll be happy to do so. And I've asked in order to be able to answer to you correctly over the next few weeks, because, screening is something that we're going to continue doing for many months yet to come. So I have asked now that when we do conduct tests on a daily basis, 30,000, 35,000, that we get a result of PCR tests, rapid testing with ID Now, with the different companies to show you under what circumstances they were used, linked with the recommendations. Sorry, it was a lengthy answer. It was a good answer, but I want to add to that answer because I find that it's a very serious accusation that this professor is making. I find that it is irresponsible, and I want to give you a few numbers. Yesterday, 36,000 were conducted. So it's 4,302 per million inhabitants. In British Columbia, it was 2018 per million inhabitant, and we did 4,302. Everybody else was in the 2000s. So when a professor tells us that we are responsible for people's deaths, I find that this is a very serious, irresponsible accusation. But at the same time, these tests could allow us to break the transmission chain. But we're not missing any tests. We're not lacking any tests. Now we're told that we should use rapid tests that are not as reliable to do more tests, but we're already doing a lot of testing. If you'll allow me, if we're doing screening tests that are not reliable, it can be even more dangerous. Because if we think that we have a person who is negative, and because the test in 1 case out of 3 is not reliable, we may end up with people whom we believe do not have the disease, but who do and continue contaminating people. So I think there's a question of responsibility here. And I'd like for us to be able to, the opportunity of explaining it to you more in detail and to say what the equipment is that is required. So if we need a technical briefing to clarify that, I'll be happy to organize one in the next few days. So the guideline they were talking about, Mr. Dubé, is that a guideline so that we continue with the pilot project approach? No, not at all. What we've done, Madame Crête, is, if you'll recall, we made a validation, particularly in the months of November and December, because we wanted to see, but now we are no longer there. Now that we are truly comfortable, after having made these validations, in which cases we can take a good risk, that is, let's take a very simple example. In a business setting, and in a business setting like, let's say, at Olimet, there were big outbreaks. But now you are sure that you can quickly do a first triage because you know that you will have 20 or 30% of people who have symptoms. And after that, it's very easy to go confirm people to see whether they are symptomatic or not. So that it is. That's why it is in certain cases, and I think businesses are good cases. If there is a significant outbreak in a school or a place of work, in the guidelines, we've put the cases where we ask our people to go do it more quickly to try to better take control over an outbreak.
Bonjour, Monsieur Legault, vous le dites, 1264, je pense, c'est beaucoup trop.
So you said, Mr. Legault, that 1,264 is too many. But what is the target then? Is it 1,000? Is it 500? How many do we need to stop leaving aside treatments and surgeries? I think that we have to see, and I talk a lot about it with Dr. Arruda. What is being developed more and more are two kinds of Quebecs here. One is Montreal and the greater area, and then the rest of Quebec. And right now, when you look at the number of cases, what we had this morning, 1,264 cases, 2/3 of those are in the greater Montreal area. So, of course, and you see the implication of the hospitalizations that go with those cases. It's directly proportional. So it is the Montreal region that is the most affected in terms of hospitalization. So when you ask us the question, and that is what we'll be able to give you other indicators next week, it's not just the hospitalizations. It's also everything, all the postponements and delays that we have to bring about in each of the greater hospitals in the Montreal area. So I think that now that we can see that postponing surgeries and treatments is really hurtful and that we want to minimize it as much as possible. Well, what I'm saying is that we're going to have to take into account that not only the cases are going down, but that we can, as quickly as possible, eliminate the negative effects of postponing treatments and surgery. So it's not just the number of cases, the number of hospitalizations that we have to take into account, but it's the effect that we can have on eliminating those delays and postponements as quickly as possible. Orient Express is planning on cutting down public transportation. What are you planning on doing in the Gaspésie region? Well, we're going to help because we've had other problems. François Bernadette should be able to announce some good news soon.
Premier ministre, Monsieur le ministre de la Santé, Dr. Arruda. Monsieur le Premier ministre,
Mr. Premier, you said earlier, and Mr. Dubé just said that there's two Quebecs. There's the Montreal Quebec, and there's the rest. I'm not making it up, he just said that. When you say that the curfew, you talked about the curfew earlier on, is it possible that what you'll be announcing next week is that we're keeping a curfew in the hot zones, such as Montreal, and that we will be lifting that measure in the rest of Quebec? First, where the hardest hit areas are the 4 neighborhoods of Montreal. But after that, there's still a lot of cases in the Laurentians, in La Naudière, in the Montérégie, in the Eastern Townships, Mauricie, Centre du Québec, Chaudière-Appalaches. There's still a lot of cases and a lot of hospitalizations. And there's even postponements in a lot of these places. So it's not just Montreal. It's worse in Montreal, but... And then you go to the other extreme, the very north of Quebec. So Abitibi, Nord du Québec, Côte-Nord. I would add to that perhaps the Gaspésie, the Bas-Saint-Laurent region, and the Outaouais, not Outaouais, I'm sorry, Saguenay-Lac-Saint-Jean, where there are no longer many cases. But if we're talking about Quebec as a whole, there are still a lot of hospitalized people. So all that to tell you that it's not just going to be in Montreal, the curfew. Therefore, the curfew will remain beyond the 8th of February. It will be announced next week. So is it possible? It's very possible that it will remain beyond the 8th of February for regions, only affected regions, or all of Quebec? Well, one or the other. Monsieur Lacroix, if you'll allow me, just for it to be clear, hospitalizations is one thing, but we've seen it. Remember, when things started really exploding in the Saguenay-Lac-Saint-Jean, a region that had been almost not affected for 8 months, it moved in the click of a finger. But what went up very quickly went down very quickly as well. So when I say that it's not just a question of hospitalizations, there's also the speed at which this is spread. There's the entire question of the staff. In Abitibi, we have problems with staff as well to be able to operate on people. There's also delays. There's also postponements. So that is why I'm saying, yes, there are two greater regions that are impacted differently. But when you look at all the other factors and take them into account, you know, the variance that can come in, if it arises in the Saguenay-Lac-Saint-Jean, we're going to have the same problem and even greater than we've had. So yes, we can see right now that it is in the greater Montreal area that things are the worst, but that virus can very quickly spread everywhere. But would it be applicable to have a curfew that would not be generalized to the entire province of Quebec? Could it be done, for example, regionally? Or if we emit a measure such as a curfew, in order for it to be efficient, it has to be Quebec-wide. I don't want us to answer today because the objective is to answer next week. But what I would like to tell you, and perhaps I'm going to put my foot in my mouth, maybe I should put my mask back on, but it's all of that we are taking into account, because there's one thing that we can see is that it's working. The curfew is working, and we can see that it works. And I'm telling you, people that we meet tell us, well, at least it's clear. We know the rules, and what is encouraging is that we can see how things have gone down. So I'm not going to say more for today, but for sure it is something that is working and that encourages us, because you can see the numbers go down every day. So there's at least that's encouraging. You said very clearly that Quebec cannot create a bill to manage the quarantine for travelers. If Mr. Trudeau does not answer to your request, will Quebec just have no other options? Is it impossible for you to act differently using by decree or by using the Act on Public Health? Well, I've asked jurors to work on it, but what I'm told is that the risk that it be contested would be very significant. So, of course, the situation, and I hope and I trust that in the course of the next few hours, Mr. Trudeau is going to be announcing one or the two options. The kinds of options, would it be the Act on Public Health? Ourselves, you mean? Well, yes. Would it be, preventing people who are coming back from traveling to be able to circulate? Well, listen, I'm an accountant. I'm not a legal specialist. I'm going to let lawyers work on that. But the objective is for travelers to come back to Quebec, be forced to go into a supervised hotel.
Oui, bonjour à vous trois.
Hello to all three. Concerning the postponement of treatments and surgeries, I understand that you're telling us that there's still a lot of hospitalizations, and I also think that people understand when you say, and I think that they're sensitive to that. But at the same time, when there are orthopedists who say that the waiting list can go up to 5 years, and you're a person who is waiting, and you're waiting for surgery, what people want to know is not whether there's still too many hospitalizations. It's when are we going to be able to open up those rooms again? Now that cases are going down, can you give an idea? Well, listen, the good news, I would say, because we're following it, you cannot imagine how closely we look at that every day. You met Dr. O'Patterney a couple of times. That is what she keeps an eye on every single day, that she discusses with her clinical committees. What I want to say is that the good news that we've had that is going to allow us to start doing it in collaboration with the unions, as I'm saying, because our people are tired. If we were to listen to, our unionized, the nurses, they want to have a break, and it's normal. It's been 11 months that they've been at the front lines, carrying this burden on their shoulders. So the good news is that we have at least eliminated the progression. When we got to 1,500 hospitalizations, having come back to about 1,250, well, now we can start replanning to be able to have certain surgeries, which is something that we couldn't even consider 2 weeks ago. So I'm telling you, how are we going to be able to do it? Are there regions where we'll be able to go more quickly? And that is why I want to say again that there's 2 Quebecs, because it may be easier to start doing surgeries again in the Quebec City region than it is right now in the Montreal region. So to your question, yes, we're going to be coming back. Yes, we've started already. I think that it's Friday or Monday that we're going to be given certain guidelines to our CEOs to be able to start replanning surgeries, but that are going to be taking into account the specificities of certain regions. My second question has to do with the number of doses that we're going to be receiving in Quebec, the vaccines. In your talks with the other provinces and the federal government, have you been told that by the end of March it was 3.5 million doses that we're going to be getting, or was it 4 million? Because now there's a confusion. It's a difference. There's a big difference between the 2 numbers. And do you find that there is a confusion as far as the number of doses we're supposed to receive in Canada? Well, not only is there a confusion for the number, but for the dates as well. I learned that, as you did this morning, that the delivery of the 1st of February was now going to be delayed, that the deliveries of the week of the 8th of February, I immediately called Daniel Parent, who's responsible, to say, well, what's going on? And he's waiting to get news on that front as well. So not only on the numbers, but the dates. So what was confirmed to us and what Mr. Parent was confirmed, what was confirmed to him as well, is that Pfizer would still be able to send us 1.3 million by the end of March. That's all we know as of now. But the details of how it's going to be delivered, right now we don't know.
Ministre, Dr. Arruda, Monsieur le ministre de la Santé. Monsieur Legault, on comprend.
Mr. Legault, we understand that what you just explained to us is the Vallée du Saint-Laurent, Chaudière-Appalaches, the Eastern Townships, it might stay in red. The spring break worries you. People have already made reservations for their cottages for the spring break. Are you thinking of bringing back roadblocks to avoid people leaving from Montreal to go to Sainte-Adèle, for example? Well, of course, we're looking at many different scenarios. The problem with roadblocks is that they have to be have police officers, and police officers right now are doing very good work to be able to keep an eye on guidelines such as a curfew. And as I said, it's a measure that works well, so there's good chances that it will stay. So there are chances that we'll need police officers to apply the curfew. Of course, if we had to choose between keeping an eye on the curfew and the interregional transfers, the priority is to keep an eye on the curfew. And we're going to have to see as well how we're going to be able to draw the map of Quebec and what will be in red, what will be in orange. So as long as we have not defined that, it's another question. But honestly, I think that what is important is to continue with the good work that's doing a good result of keeping a good eye on the curfew. We understand that you are trying to save your Minister for Education. There's a problem for communications? Not at all. Listen, I'm very proud of having Jean-François Roberge as the Minister for Education because he's done a lot since he's been there. This guy has a lot of experience. He was a teacher. He's a father. We are right now experiencing a crisis that is unprecedented, and I wouldn't want to have anybody but him to be able to manage it. Now, the communication part, that there's transfers between, people who are responsible for communication between the different ministers. It's not the first time. So you want the message to be able to be better? Well, there's a question of individuals first. You know Jean-François, who is going for, it's a new challenge at education. It's an important ministry. So you're showing that you're worried about the British variant that could be responsible for a third wave. And it appears that Quebec is doing very little research to try to detect. There's only 3% of the positive samples that are being sequenced with the genome to know whether it is the British variant that is present. And, in the water, where we could do research, we don't even know where that is. So why is that? Is there such a delay? You have doubts? What is it with the presence of that variant in Quebec, and what efforts are being done to be able to discover whether it's there? I think we are perhaps one of the places that's doing the most work on that, but I will let the Minister of Health, perhaps. Maybe I'll start. But I think we are on the point of announcing a very significant investment, $11.5 million, that will allow our researchers to be able to do sequencing on the different vaccines. I'm wondering if it's today or tomorrow that will be announced. But it's very clear that we want to be able to increase the percentage. When we're saying sequencing, it means to analyze the tests that have been made to see whether there's a new variant there and which one. So we are investing, and perhaps Mr. Horacio Arruda could complete on that, but it will be announced. We were at 3%. We're going to increase at 10% soon. We're already at 5% in the past few weeks. And we consider, if we compare it to, the U.S., which is 1%, Great Britain 5 to 7, but our 10%, if we target it to the more at-risk patients, we'll be able to detect any variant pretty quickly. Right now, we already have detected some. There was no transmission, no significant transmission. We're now at the 7th case that I was told. I'm waiting for the clinical information about this, but we're giving ourselves a capacity that is going to be one of the best ones in Canada. Very well. In your projections, Mr. Legault, I still see a change. Maybe not a change, but in the tone in what you're saying. In the past few days, you said that there was a lowering in hospitalizations that was really good, but you're still saying we have to be careful. We can't put an end to postponements. Should I understand that in the new projections that you are going to have the possibility of a third wave and an impact on hospital capacity is something of concern? No, I just wanted to make a clarification because on Tuesday I announced that next week we would have some slackening of measures as of the 8th of February, and I saw, or at least what I read, there are expectations that there's going to be a lot of them, and I want to be very clear today. There are going to be some loosening of the measures on the 8th of February, but the vast majority of them will be kept. Yeah, I don't like adding things, but each change that we have in all the hypotheses that we have can make a great difference. The fact that the vaccines are going to be vaccinated, that the vaccines are going to be delayed by another week, that's not good news that we're having, for vaccines. Let's be clear. So we had people that we planned on vaccinating in our PAs, and that we're not going to be able to vaccinate them. So we have to take those circumstances into account as well. You were talking about the variants. I'm talking to you about the vaccines. So we have to take that into account as well in the hypotheses that we have. And now I'm saying about the vaccination, we continue doing the work. We've already hired through Je Contribue, it's important to say, so we're now at 1,500 people who are going to be new vaccinators. We are training them right now, so we are doing things in the meantime. But all I'm saying is that this is another variable, and we're really looking forward to being able to vaccinate so that we can get to our vulnerable people. And so what you're saying basically is restaurants in Quebec, forget it, Is that what you're saying? The answers will come next week. But I don't want the expectations to be too high.
M. Belrose d'un deuxième tour.
Il y en a un qui a plus de cheveux.
Bon. Tout de suite.
There was a mix-up in the names. Well, one has more hair than the other. Oh, personal attacks, says the journalist. There's other countries that are much more advanced with the vaccination process than Canada. What could we have done more in Quebec, and what could the Prime Minister have done to proceed differently so that we get more doses more quickly? Well, listen, generally speaking, it's really difficult for us who were not involved in the negotiations with the pharmaceutical companies to know what is in the contracts and what we could have had in the contracts. It's very difficult to have that information. Of course, what is important is not just the number of vaccines. It's the delivery date of the vaccines. So there seems to be a debate between the different regions of the world. I can't say more than that, honestly. We don't know what the contracts are. We don't know what the negotiations were. So it's another aspect on which the federal government has left you a bit in the dark. You've been very critical of the federal government in the past few weeks. You have regularly criticized the Prime Minister, Justin Trudeau. You have no control over the vaccines, over the airports, over the quarantine. Perhaps in another political career, it was files on which, oh, are you leading to a referendum question here? Well, you wanted to have control over those things. Does that not take your federalist convictions? Are you telling me that you think that you'll be able to organize a winning referendum before the end of the pandemic? Well, you're the one who could tell me that. Well, I don't think so. But in your convictions, does that change anything on the perception that you have of Canada right now? Well, listen, it's never simple, and there's nothing that's perfect. We have to see what the alternative is. Are Quebecers ready to vote yes in a referendum tomorrow morning? I think that having a party and a government that is trying to make Quebec more autonomous, who is trying to ensure that we can have more decisions made in Quebec, I think that is the best alternative still.
Nous allons maintenant prendre une question d'un journaliste en télétravail, François Carabin, Métro.
Oui, bonjour, messieurs. J'aimerais revenir au cours.
I'd like to get back to the curfew, Mr. Legault. Since the beginning of the press conference, you have been declaring that the curfew is working. What makes you say that it is the curfew that's working and not the other measures that you have announced, that you were announced in January, for example, mandatory working from home? Well, listen, the greatest worry that we've had for a certain amount of time, for weeks, if not months now, is what is happening in people's homes in Quebec. We have asked people to not have visitors from other homes. If that had been respected 100%, we would not have needed the curfew. So we have to look at all the measures. What we understand, there's no direct evidence, but since we've been applying the curfew, there are fewer people visiting in other people's homes. There's fewer contagions, particularly in those people 65 and over. So the model that we have right now, the total model that we have, is giving good results. And I'd like to come back to the decision of your government of modifying the decree on the curfew. Are you going to be asking for the tickets that were given before this modification be cancelled? That is to say, the ones that were given to the homeless? Well, first, there was never any question of giving fines or tickets to the homeless only because they're not respecting the curfew. There were tickets that were given to some homeless people for reasons other than the curfew. But there was an adjustment at the beginning where a few tickets were given only because the curfew had not been respected, and those will be cancelled. We will now be going to English questions.
Good day to you all. Mr. Arruda, you just said that you have a 7th case of the UK variant. How worried are you about that variant thriving in Quebec, and what are you doing to block it?
First of all, what is most important is to make sure that people respect their quarantine. If there are cases, that they're going to be at home, they will not transmit the disease, because the issue is that you can have those cases, but with no big transmission. But I think it's very important to make the follow-up, because even if we get this 7 and we had no big story for the moment, they came from everywhere. So it's why it's so important, the international approach and traveling that we're going to have in Quebec.
And that'll be enough?
I think really, because it's almost everywhere, and I would say probably some countries don't have any genomic way, it's almost impossible to not get it one day. What we are hoping is to delay its introduction and make sure that our vaccine is going to be enough done to limit the impact.
And I have one on masks. We're seeing in Europe, some European countries are now, the public health is recommending people wear 2 masks, or that people wear a medical mask instead of a cloth mask. Do you think Quebecers should do the same thing?
What we are, and we just have some new recommendations from the Institut National de Santé Publique. When we talk of the double mask, it means that the patient and the caregiver will use masks. We call it the double mask. It's not 2 masks, it's a double mask. It means that you have your mask and the patient too. So that is something. And we are also making some recommendations of the better quality of medical mask, which is level 2. It's something that's going to be done. And we also had published from ESST some new norms to make, I would say, cover face like this as much as good as medical masks. So that's the kind of thing we're doing right now.
Sure. Global.
Good afternoon. When it comes to new restrictions on traveling, international traveling, you say that Quebec cannot act without the federal government. But we see, Manitoba bringing in rules like people traveling from Western Canada need to isolate for 14 days. Opposition parties this morning said the same thing, that Quebec should be able to take matters into its own hands. So why are you not able to do that?
Okay. But first, there's a very important difference between international flights and inter-provincial flights. We have jurisdiction over inter-provincial flights or traveling. Our situation is different than the one in Manitoba because of the very close working relationship between Gatineau and Ottawa. As you know, many people from Gatineau, they work every day in Ottawa. So in practice, it would be tough to control all the entry from Ontario. It would make sense, and I understand why Brian Pallister is doing it, but for us, because of this link between Gatineau and Ottawa, it would be tough to implement.
And on the international travel, you can't act either.
The lawyers we have are telling me that there would be an important risk of contestation, challenge, a very important risk of challenge, yeah.
Okay. On the vaccines, you mentioned there's more bad news. There seems to be bad news after bad news. How concerned are we in trouble with the delay in vaccines, because people who have already got their first shot have to wait longer and longer and longer, and we're getting fewer doses? Should we be worried about the number of vaccines that we're getting?
No, I think what I said, and I'll repeat that, we would like to have them as promised and delivered as promised. What we're being told is the amount of approximately 1.3 million doses will be still delivered by March 31st. So there is no issue for the second dose. There is no issue. If we get those doses within March 31st, will be exactly according to our plan. The issue is that the people we said that we would like to perform vaccination this week, like in RPA, but we cannot do them because we don't have the vaccine. So we'll need to postpone those appointments that we had with them previous for this week and next week, and we'll do them in February.
Maya Johnson, CTV.
Good afternoon to the three of you. Premier Legault, my first question is in two parts, and that's because it's related to a couple of different marginalized groups who share similar concerns and are both asking for help. So first, are you willing to increase funding for organizations that help new Canadians and refugees who are struggling to integrate during the pandemic? And second, are you willing to increase resources and take a more targeted approach to Montreal North, which is a neighborhood that is among those hardest hit by the pandemic, particularly because of the high number of essential workers in that area?
Okay, as you know, for the refugee, we accepted that we'll have an accelerate way to accept them as immigrants if they've worked during the pandemic. So, of course, will help them very much. For the other ones, the refugee, it's under the jurisdiction of the federal government to decide if they have good reason to be accepted as a refugee. Your second question is about Montreal North. We worry a lot, and we've increased the number of tests in many ways in Montreal North. It's one of the places where we have the most new cases every day. So maybe you can continue.
We've asked our PDG of those CIS and CIS to act and have mobile vaccination being done there to make sure we increase the availability of tests there. So that's what we're doing right now, and hope that we'll be able to get additional result. But we have asked for that. I think that was last Thursday that we asked for that.
Okay, and Premier Legault, your government's first official reaction to the court ruling exempting homeless people from the curfew came from Junior Health Minister Lionel Carman. So why did you delegate that task to Mr. Carman? Why was he the messenger?
Well, first, he's not a junior. He's a good guy, and he's in charge. And as you may know, he's my neighbor, and we're talking very often. And
of course, with all due respect, I'm speaking about Minister Dubé versus Minister Carman. They have different responsibilities.
Mr. Carman is able to take care of the homeless, and it's under his jurisdiction. That's clear. But one thing I want to be very clear about the homeless. For me, nothing has changed. Since the beginning, we've asked our police officers not to give tickets to homeless only because they are homeless. If there are some violent cases or other reason to give tickets, it's another story. But homeless, because they don't respect the curfew at 8, they were never supposed to receive a ticket. I know that few of them, maybe couple, a lot less than 10, receive some tickets, and we'll take care to make sure that we cancel those tickets. But nothing has changed. Police officer will continue to try to help the homeless, try to bring them in a place inside. But they weren't supposed to give tickets before, and they won't give tickets except if there are other reasons to do so. But of course, they will have also to ask information about the people, make sure that they are homeless people, that they don't have a place to stay. So they'll do the same work as before.
Clarification here in terms of the response to this, because you've been the face of that message. You've been the one as premier who's been defending not exempting the homeless from this curfew. So why wasn't it you who addressed the court ruling on a very controversial decision?
But I took the decision. When we had the court ruling, I took the decision to say, hey, we'll comply. And it was announced by Lionel because he's in charge of this subject.
Merci. Avant de donner la parole à Cathy Sonnier, je vais vous demander de répéter en français.
Could I ask you to repeat your answer in French?
Deux de ces questions sur la
Particularly two of these questions on the worrisome situation in Montréal-Nord and what you've started there, particularly on vaccination, and then the decision of the Superior Court to be able to make sure that people who are homeless do not get fined. Okay, well, I'll start with the homeless. One thing that is clear is that since the very beginning, there was never any question of giving tickets to the homeless only because they did not respect the curfew. There were a few errors that were conducted. They will be corrected. Now, when we got the decision, we right away adjusted ourselves. At the beginning, it was to ease the work of police officers, but police officers still have the same rule that they had at the beginning. That is that they are not to give fines to the homeless, to people who don't have a fixed address, and it will continue to be applied. As far as Montréal-Nord is concerned, perhaps, Christian? Okay, I'll repeat what I said. I think that is, as of last Thursday, we asked for a specific effort made in the 4 regions from Montréal-Nord to Montréal-East to do additional testing, more mobile tests, as they're called, so mobile vehicles. Each of the CEOs has to present to us a plan so that we be able to get more results in those areas. And that's been set up. I'm thinking about the CIS of the Est de l'île, the eastern part of the island, that has already had mobile clinics. So that has already been set up to go get information. Very well. Go back to English questions.
Good afternoon to all of you. I'll ask you this question in French and then in English. Premier Legault, le gouvernement fédéral.
The federal government has just announced that the 29th of January will now be the National Commemoration Day because of the terrorist attack at the Grande Mosquée of Quebec City and the fight against Islamophobia. I know that in the past year you've said that there is no such thing as Islamophobia in Quebec, but what do you think of that day, and would you like to do the same thing in Quebec? Well, first, when I leave here, I'm going to go record a message, because this year, the ceremonies concerning the unfortunate anniversary of the attempt at the Quebec mosque is going to be done virtually. And of course, this was a show that is unacceptable, a show of hatred and intolerance, and we have to remember it so that it never take place again. And of course, I totally agree with what Mr. Trudeau said, but that it also be a day of activity against Islamophobia. Is that something that you want to do in Quebec? Well, I don't want to get into the debate of Islamophobia. There are people in Quebec who are racist. There are people who are intolerant. It is unacceptable. So I'll stop there.
In English, the federal government has announced it will recognize January 29th as a national day of commemoration for the Quebec mosque attack and fight against Islamophobia. Since you said last year that you didn't think that there is Islamophobia in Quebec, what do you think about having this day to commemorate January 29th? And would you do the same thing in Quebec? Okay.
In the next few minutes, I will register a video to tell all the Quebecers, and especially the Muslims that were involved in this terrible act that happened 4 years ago. It's unacceptable in Quebec. I was happy to see that in the few days after what happened, many Quebecers, even if it was very cold at the time, if you remember, they went out to show that they don't accept that they are not happy about that. I think it's important that we remember what happened at the Mosquée de Quebec in order that it doesn't happen anytime. Now, there are some racism in Quebec. We have to fight against racism, all form of racism in Quebec.
Oh, Islamophobia is not necessarily spread in Quebec.
There is racism in Quebec, and we have to fight against racism.
Merci beaucoup. Bonne fin de journée à tous.
Thank you, everyone. Have a good day.